Hi folks, this is Dr. Manon here. I'm a medical director at the Blue Peanuts Medical Education. Today I'm going to speak to you about something that's really been asked of us quite a lot. A number of our students and parents, of course, are contacting Blue Peanut regularly because of impending questions that many have. One of those questions is about this time of year, students in year 11, year 12, and indeed some year 13 students as well. They're normally trying to do work experience, they're trying to do volunteering in GP settings, shadowing doctors in the hospitals, working in care homes, helping out with the hospice folks, volunteering at charity shops, and so on and such forth. Often work experience and volunteering traditionally has involved going there in person, being part of a team, working with people and actually getting a feel for what that environment is about, what healthcare challenges there are, how people work in trying to deliver service and helping people. And this forms a very important part of demonstrating interest, how keen you are and how serious you are about getting into medicine later on. Now, of course, given the COVID situation, this is somewhat compromised, right? In that you can't physically go to GP surgeries, hospitals, care homes, hospices, charity shops, so on and such forth, because of the social isolation issues, social distancing issues. Often you're dealing with a cohort of people in those environments who themselves are isolating and shielding, so you can't physically be in touch with them. So naturally, there's a crisis of thinking out there. People are worried, well, how am I going to demonstrate this area of interest when it comes to writing up my personal statement? What am I going to say at interview? Goodness me, this is not looking good. So that's why people are contacting us and wanting us to provide solutions and answers to that. So I thought I'd put down a few suggestions in this video so that perhaps it might help you in working out where you get, how you can tick those boxes, should I say, for want of a better word. I would suggest have a think about being innovative about this. Have a think about, how would you think outside the box here? We still want to achieve the goals of showing interest, showing that we've researched our chosen proposed careers. We want to show that actually we've gone out of our way to try and get some experience and understand the field of medicine firsthand. So whilst we can't go there physically, is there any way to do this in a more remote way? All right, have a think. All right, and actually, if you think about it and give it some careful attention, I would argue there's lots of ways to demonstrate this in a succinct way. Take, for example, if you was to help out with food banks, food groups, soup kitchens, all helping vulnerable people who are struggling at this moment in time. How about volunteering and getting involved with folks like that? Whilst they're not in the healthcare setting per se, it still demonstrates the fact that you're getting involved in community interest work, in work that helps the needy, the poor, people who are most vulnerable. How about becoming a remote volunteer? A remote volunteer. Not a physical volunteer, but a remote volunteer for the likes of the befriending service that your hospice might run. So they still want to provide support and friendship to their patients, albeit not physically. You can provide that in a remote way, over the phone, or video calls even. All right? There's something perhaps about becoming a delivery volunteer for your local community response team, or even a food bank or a food share group where you deliver, say, shopping, you deliver food items, you deliver personal errands and things like that, really, that can be done as a delivery person. How about fundraising? You don't have to be there physically. How about physically fundraising for your hospice? Remotely fundraising for your chosen charity. And charity doesn't have to be just within the UK, it could also be abroad. Remember, COVID isn't just affecting people in the UK, it's also affecting people all over the world. So you could look out for charities that support humanitarian causes, abroad, places like, let's say, Africa, places like the Middle East, like Syria, Yemen, and so forth. Have a think about doing something like that. So if you think about it, albeit not physical, you can actually get involved in a lot of volunteering opportunities in settings which show that you can provide leadership, you can be a good team worker, you can get a good understanding of human needs, how you can actually engage with people and help people. So just a thought, guys. All the very best. My name is Dr. Abdul Manan, Medical Director at bluepeanut.co.uk. Thank you.